let's talk a little bit about shoulders. I
Sure.
mean, we have folks at Sun City who are avid golfers and tennis players and swimmers, and they're experiencing some shoulder issues. So talk to us a little bit about what you're seeing and
Sure.
what to look out for.
What we see a lot of times as we age are changes in the posture. As our low back starts to flatten, our shoulders round forward, and we wind up with what's called a forward head posture. That change in the tilt of the scapula or shoulder blade has a tendency to put some structures of the shoulder in an area where it causes rubbing and harm. So initially we develop bursitis, tendinitis, and those may eventually evolve into the growth of osteophytes or bone spurs in the joint, in turn leading to the need for either cortisone injection, steroids, or hopefully on the more conservative side, changing that posture while it's still early on to eliminate those irritations and improve the posture so we can maintain our range of motion and keep up with activities throughout as we age.
Now, a twofold question for you. At what point do we know that we're in a danger zone? And secondly, what are some of the things that we can be doing to mitigate?
Sure. You may initially find that after working in the garden or an extra 9 holes that we wind up with some soreness that surrounds the shoulder. Usually it starts to present itself more as bursitis and a general ache on the lateral shoulder. If that doesn't clear up within 24 to 48 hours or with applying ice to the irritated area, then we may start to see things like tendinitis start to evolve and may require intervention from a physical therapist or your orthopedic surgeon that may provide things like anti-inflammatories or even a cortisone shot to the shoulder. But most of that starts with making sure we have good posture, shoulders back, and keeping things out of the way of the joint doing what it does.
Now, is there a way to avoid having surgery? If we've been told, I know some folks at home might have been told that they need to have surgery. Is it good to take a second look at that, or?
Sure, of course we'd rather be conservative initially. We'd, by doing things that improve the strength of the scapular retractors, by stretching some of the structures on the anterior shoulder, and releasing some of these upper trapezius muscles that have a tendency to develop trigger points and alter the way your shoulder moves. So between increasing the flexibility and improving the strength of the surrounding rotator cuff muscles, we may be able to avoid the shoulder surgery completely. So we initially will try that in hopes that'll keep you out of having to have any surgery.